Welcome to Leadership Rediscovered. I'm your host, Laura Siebold, and today I am so honored and thrilled to welcome back for round two, David Goldberg. David Goldberg, thank you for being here.
Oh, thanks for having me. It's so good to be with you again.
Oh, well, round one was very successful. We got a lot of good feedback. And during those episodes, which for those of you that have not heard or listened to them, episodes 26 and 27,
Wow.
We're now in the 80s.
Oh,
so it was a little while ago.
No wonder I feel so old.
No, we haven't aged. It's just the episodes have gone on. But episodes 26 and 27, I read your bio. This time around, would you give us your bio and talk about your role as CEO and president, right?
Well, first, I'm CEO and president, but I'm dad of two daughters. I always start with my Reagan and my Ryan. And married to Noelle.
Yes.
I mean, that comes first. But I've been for 5 years now. I'm president and CEO of Mon Hill System here in Morgantown.
Yeah.
And then since our merger, I'm also executive vice president of Vandalia Health, which is the second largest health system now in the state. As of today, the Davis Health System, based out of Elkins, West Virginia, Philippi, West Virginia, and Webster Springs, West Virginia, those three hospitals and staff are official members of the Vandalia Health System. So we're 14 hospitals owned, 3 managed affiliated. We're about 14,000 employees when you count Davis into our health system. We're in 4 states. We're mostly in West Virginia, but we have clinics in Virginia through some acquisitions, as well as Pennsylvania and now Maryland. So real excited. Been here 5 years and been in a couple other states with other health systems, from Texas to Pennsylvania, Virginia, and now back home in West Virginia.
And I was going to say an adopted West Virginian. West Virginian by choice. Yes. I love that line.
Yes. And going to the basketball game tonight, he's hoping for another win.
I know. Exactly. Well, that was one of the reasons I wanted to have you back, because when you were first here, you were Vandalia at that point, but it was still pretty new. I mean, it's still relatively new.
Yeah, we're about a year and a half, a little less than a year and a half into it.
Yeah. And I just think about anytime you go through, whether it be a merger, an acquisition, anything related to that, that's a massive transformation for an organization and heavy impact on leadership. So I would love to hear your perspective now that you're a little bit further along the journey, just highs and low points or lessons learned as you've brought these health systems together and created something new.
So to remind your listeners or your readers and you, when I got here 5 years ago, Mon Health many years ago started as just Mon General or Mon Health Medical Center, and then merged with Preston Memorial in Preston County, and then Stonewall Jackson Memorial Hospital in Weston, which is Lewis County. So they were going, and we were going through a version of integration back in the day. And one of the things the board wanted when previous leadership left and they wanted a new leader was to integrate what was then the 3 of everything, 3 different hospitals, 3 pension plans, 3 health insurance plans, 3 financial systems. I inherited 16 electronic health records.
Oh my.
And when we acquired and physician groups joined whatever hospital they were a part of, they kept them on their IT platforms, information technology. So part of it was we need to get to one to be integrated. Why? Reduce your cost, get access, be able to be more consistent. So I've done this multiple times in the different organizations I've been with. Many years ago, when I worked at a hospital called Loudoun Hospital, I wasn't in operations, but ascended into operations. We merged into a much larger health system in Northern Virginia called Inova. So I kind of understood what that felt like to go from independent into a larger system, and then moved to Texas. And then we were an integrated system in Texas under one license, meant everything was one, even though we had 4 to 5 hospitals. And then from there, we were bought by another larger for-profit. So then had to merge again. And then I went to Pittsburgh, where Highmark bought a struggling health system called then West Penn Allegheny, which is now Allegheny Health Network. And back then it was, I always called it a confederation of assets, same thing. And then part of the goal coming in was, as Highmark bought these assets, to make it into an integrated delivery system, then connecting to Highmark, which is an insurance company, to create what's called an integrated delivery financing system. It was another opportunity to learn integration. So here we are a year and a half later. It is like we always were family, and that's very rare when you merge. The culture of the CAMC or Charleston Area Medical Center Health System leadership led by Dave Ramsey, Glenn Crotty, Jeff Sandine, and a host of wonderful people all understand what it's like to really be focused on community, really be focused on the patient outcome, really be focused on making sure that we bring the right level of care to the communities where the patient is. That has been the MON model, and then me coming in, be able to expand upon that. So it made it very easy to be aligned. And then today, the Davis Health System, same thing. We acquired 2 additional hospitals earlier here, Greenbrier Valley Medical Center in Greenbrier County, Plateau Regional Medical Center in Oak Hill. They were acquired from a for-profit who wanted to divest out of those assets. So those were acquisitions. The others were mergers. And it does take time and understanding to build understanding. I call it, when you're in matrixed organizations, it's Mastering the Matrix. It's a great book. And in it, it talks about the fundamental beliefs of a really good integration and working in the matrix has to be communication, has to be trust, and it has to be transparency. And I really feel that we're on the path of really embarking on something different to get there. And a year and a half in, is it perfect? No. There's no integration, no merger, no acquisition, affiliation that's perfect. But I think the path we've taken is really put a lot of, I'll say, hitch in the get along to be able to do the right thing for the communities we serve. And
I think about, because you mentioned as well, the cultural piece. I mean, first of all, anytime you're doing integrations, just the systems alone, that is logistically and operationally very challenging when you're trying to get to centralized systems, centralized processes. How do we do our billing and all of that? But then you have the whole people side and the cultural side too. And sometimes that can be a real challenge, especially if it's, hey, we're used to doing things our way, and this is how we do it in this part of the state or whatever, and this is what we're familiar with. This is how we've always done it, and maybe we're not open or interested into doing something different. Do you feel like you've maintained some separate identities as cultures, or have you really tried to come and just say, no, we're just, everybody's really acting and believing and behaving the same way?
So if you remember episode 26, 27, whatever you said, and now we're in the 80s. I feel like I'm in my 80s. I wore the green logo. I mean, if you remember, now I'm wearing my pink logo. And if you come into Monongalia County, or if you're in Preston County, if you're in Harrison County, the Mon name is still the name you know. We've included Vandalia to it. And I give Dave Ramsey, I give the board led by Bill Rice and Ron Stovash a lot of credit. People know the hospitals. They know their doctors. Do they care about the system name? They want to know what they've always known. The Mon Health system with Preston and Stonewall and Mon Health Medical Center or Mon General has 75 plus years of history. You can't just take that away, and I don't think you should. The Charleston Area Medical Center, or CMC, is a little over 50 years old as independent hospitals that came together. That's what the people in the southern part of the state know. So there's inherent cultures in each region, as you call it, but our goal is to become one Vandalia, to have one approach. But regionally, you're going to have different areas and different things you have to address. You know, one of the fundamental things we addressed early on is the medical staff approach. The medical staff to the north, it's literally 2 hours and 21 minutes from Mon General or Mon Health Medical Center to Charleston Area Medical Center's General Hospital. Yes, I drive it a lot.
I was going to say,
right down 79. But we are different. Some of the issues that we deal with in the populations we serve are slightly different. However, the approach to medicine is evidence-based. It's consistent. So while we might be regionally a little bit different, we're closer to Pittsburgh. Charleston is a little bit closer to the southern part of, northern part of Virginia, southern part of West Virginia. The basics aren't different. And we're a very transparent organization. We try to share what we're doing, why we're doing it. We really work really hard on over-communicating the why. So people don't make it up. People don't feel they're in a vacuum. And I really feel positive about a year and a half into it. I'm never satisfied. I think I told you that back on the last episode. But here we are now, a year and a half into it. We've not lost any leadership.
Wonderful.
We have not lost any providers. We've actually grown significantly over the last couple of years. The last few months have been a record. Financially, we're stronger than we've been in a long, long time. We're living and learning how to do it better, and we are implementing systems to reduce variability, to make it easier for the doctor, the nurse, the phlebotomist to do their job easier. We're not 100% there, and candidly, I don't think we'll ever totally be there.
Sure.
But I absolutely believe that we're on a much better path.
That's amazing. Well, and it sounds like overall, there were so many similarities in terms of the approach to patient care and the philosophies around that, that even if there are some nuances related to regions or demographics, you still overall believe in the same thing and are trying to take a very similar approach. And so I think it sounds like a nice marriage of equals, you know, when you think about bringing it together.
So one of the first things that we did is Kaufman Hall was a consultant that we used early on to help us kind of map out what does integration look like?
Yeah.
And we put together groups. So we have the HR, human resource. Dave Ramsey always in meetings we have so many acronyms in our business. So what does HR mean? What is CTA? So our human resource leaders from CAMC and MON came together to map out a strategy.
Nice.
Our supply chain leaders in the North and the South came together to map out a strategy. Our lawyers to the North and the South came together. Our risk people, our compliance. And what they did, it wasn't so much about coming together to adopt, it was to learn from each other. And one of the guiding principles was what's best practice. It wasn't the MON way. It wasn't the CAMC way. What's the best way?
Yeah.
And the strong personalities of executive leadership really had to drive what's the best practice and what are we trying to accomplish and who has it. And if neither one of us are doing it really well, then where do we have to learn is the best to make it better for us as now a larger multi-state system than two regional systems moving forward.
Yeah. That is huge. And I feel like that probably was a huge feather in your cap in terms of taking that approach, because a lot of times in these scenarios, you will see maybe one organization essentially saying, you're going to do it our way. And that usually doesn't go over real well, regardless of how it's set up, just because, again, people might say, well, wait a second, we have an approach, a best practice that we're using that maybe you should listen to or be aware of.
Yes. And I think if you were to talk to some of my colleagues back at MON, some would say, we feel, so it's the CAMC way. I went, no, look at what they've been able to do for 50 plus years. When I got here 5 years ago, when we were really getting on the integration journey between Stonewall Jackson Memorial Hospital and Preston, I remember this is how we did it in this community. Each hospital is a little different. The structure is different. The licensure requirements were a little different for critical access to an acute care hospital. And I remembered that, and sometimes we pushed a little hard, and I learned from that. And those who are watching this, and you in particular, know I'm a lot. And I
don't think you are.
My wife will tell you I'm a lot. My mother will tell you I'm a lot. My mother-in-law will tell you I'm a lot. We want to be respectful and understand. However, variability, to me, is probably the root cause of so many errors that happen. When 3 or 4 different people do 3 or 4 different ways, you're going to have a gap and you're going to cause an error inadvertently. And the opportunity is when you reduce the variability, then you have more reasons to really identify what the root cause was, and then you can really fix it. And then you could hardwire it, and then you can keep measuring it. But when you look at things, do it 4 different ways, then you have 4 different ways of measuring it, 4 different data sets. How do you know what is apples to apples versus apples to grapefruit? So we really got to be consistent. And I really think the approach we've taken has been thoughtful. Some will say, not fast enough. Some might say steamrolled a little bit. That wasn't the goal. But, in healthcare today, I mean, we're dealing with, November, I don't know when we'll air, but November ended a really good stock market month. But for the last few months, the market's been up and down. We have inflationary pressures. Reimbursement in healthcare is under siege because costs are going up. The acuity of patients have been a little sicker of late. What we're experiencing, and that costs a lot of money. So if you're doing it variable ways, that means your variable costs in your business are up. How do you maintain the stability? And an integrated organization like this large Vandalia Health that we've created, part of the opportunity of doing that is to take your scale to benefit and reduce cost, but improve your outcomes and your stability.
No, that totally makes sense. And I was thinking about, with you talking about Davis, does it make those types of transactions quicker or a little bit more seamless when you are able to start building that process for integration?
There's no 100% perfect roadmap, I don't think. Davis went a little faster than the merger between CAMC and MON to create Vandalia. There were some legal bonds. We had bonds between, it's a funding mechanism that there were requirements that we had to meet. So when we first started, if you recall, when we talked about the Mon merger with CAMC to create Vandalia, we started that conversation. It's almost 2 years ago, December. Dave Ramsey and I met. We talked about it. We had a term sheet of what we thought that could work through, brought it to our boards. There was consensus. We thought we were going to close by the summer. June 30th was our original goal, but because we had some things we had to work through in our transaction, we didn't close until effectively the 31st of August and announced on September 1. So when you add it, that's 9 months.
Yeah.
We started talking with Davis in the fall. And then it percolated much faster where we came to agreements in the spring, and here we are closed in December. So 6 months. So much faster on it. Now, today is day one of that integration.
That's so exciting.
Now the fun begins from here to really work with the great people in each of those organizations to learn from them. I joke all the time, it's taking and building all of these different quilts and their patterns to build that even better comforter.
Yeah. No, and I appreciate you sharing it because I just think there's a lot of organizations that are going through transformation, and a lot of that transformation is related to some sort of merger, acquisition, divestiture, something to that extent, and people are impacted by that. And I think there are definitely a lot of times people have lessons learned from a hindsight perspective. And so to hear what your experience has been, some of the key learnings from that, I think can be helpful to others as they potentially embark on something like this and think about how can I best lead the organization.
To me, it's always about culture at the top that starts it. I mean, to me, it's like when you go to buy a car, when you go into a business with a friend or a business partner, you start with the outline. It's not always, I need to have the contract to break up. It's what are the terms of engagement? What's important to each partner? And then remember the document. Why did we start this conversation?
Yeah.
And at the end of the day, what we are is we are a not-for-profit health system. Our number one goal is to provide the care that needs to be close to home. We want to provide for the community's health. We want to represent what the community needs. We have board members from all over the state of West Virginia that are living in those communities who are sitting on our boards to make sure that we stay laser focused on the communities we serve. However, there's a business side of it. And it's becoming even more and more complex. So we have to always remember the mission, every patient, one patient at a time. We have to remember what our values are and why we're doing it, but we also have to remember we don't want to take our not-for-profit status, literally meaning not have a margin. So we can't not then take those dollars to afford pay increases. Every doctor, and I love my doctors, I met with 3 of them literally today. Every one of them wanted a multi-million-dollar piece of equipment. Every one of them today. And I said, if I get for you, then who do I take away from? And if I take away from them, what does that mean for the ability for us to take care of the community? And then at the other part, what resources do I need to bring on top of the equipment to make it right? And that's just me. Then there's the other doctors who are talking amongst themselves because medicine is moving so fast. Technology is moving fast. Medicines are moving so fast. So you can't react to everything. You have to hopefully have great people around you to identify where those opportunities are. And hopefully you make the right decision. And knock on wood, I feel really comfortable that we have a really good process to engage our physicians. My model has always been they're at the table with me. To drive where we need to go because I can't clinically decide. I can look at the dollar aspect of it and say, all right, we only got X amount of dollars to invest, but I'm going to look to the clinician, and that clinician has to be able to make their case to why this multi-million-dollar robot versus X multi-million-dollar room. While I'm still trying to figure out, I have to stay competitive in the market to pay people fairly. I have health benefits I have to provide. I have regulatory requirements that we have to invest in. How do you balance them all? It comes with constant communication and coordination.
How do you do that?
Ask a lot of questions.
I have to tell you, I have never met someone who is more responsive to email than you are. And that always impresses me because I'm like, of all people, David Goldberg's a big deal and he's very busy. How does he have time to email me back? Like, I'm nobody.
You know why?
But you're very good about communication.
Because when you reach out to me, I feel a responsibility to respond. As timely as you are to me, I feel I have to be timely. That's just how I am. My kids know it. I'm sitting here on purpose to not wear my iWatch so I won't get buzzed. but I'm hearing my phone.
Yeah.
My email box or my email system is how I manage my time. When I get a note, that is my task list.
Yeah.
So if I can answer quickly and resolve or defer it or deflect it or get it into the right person's hand, then I don't have to manage it.
Yeah, true.
So that's just the way I do it.
Yeah.
And I've always been that way. I just feel like an emergency room, you might not really be an emergency, but to you, you are.
Yeah.
So our emergency rooms, and you go onto monhealth.com, that's not a plug, it's just who we are. If you go onto our Mon Health website right now, you could see the wait times in the ER. And the reason we did that is because your emergency matters to me, and you should know on estimation how long it will take to be seen.
Wow.
Now, I'm the same way with email. I'm the same with notes. I try to be responsive. I'm not always great. My wife will say to you, wow, you responded to Laura, but I'm still waiting for David to respond.
Right.
My daughters know
the
same. My mother, people. I just think it's important to be timely.
Yeah. Well, I appreciate that because it's very impressive. On the receiving end, it is incredibly impressive because it does make you feel like, wow, this person who's very busy and has a lot of important things on their plate is still making time to respond to an email quickly.
It's sometimes hard.
Yeah, I'm sure.
And it's because you set the expectation to be timely back so people then do it. And, I go to as many of the orientations to my staff as I can.
Oh, that's right. And give them your cell phone number. Do you still do that?
I do.
Oh my goodness.
And it's on my business card.
Wow.
I give it to doctors. Politicians have them.
Mm-hmm.
I still get calls from, I call them markets, but places that I used to work. I still get calls from those doctors, from those communities, sometimes years later. Yeah. And I think it's important. But, the good thing is very rarely do I find when I reach out to people, they're not as timely back to me. And I'm not important. At the end of the day, we all are. Our job in the community is to help people move forward.
Yeah.
And if I can help, so be it. And if I can't respond, I think you should know I'm the wrong person, but let me connect you up with who can.
Yeah.
And honestly, it is my time management to get it out of my inbox. So then the things I'm leaving there, I can focus on how to respond to and make sure I don't forget the thing I need to do because that person raised it to me, and then I need to make sure I manage it.
Yeah, so it's just kind of like quick resolution.
Triage.
Yeah, it is triage. I'm impressed. Email Triage by David Goldberg. I love this.
I don't know. Okay. I'm also the guy who'll take down any organization because I save pretty much every text I get.
I save everything too. Yeah. It's my inner HR
But it reminds me. But it reminds me of what I said or someone who raised it. So it's good or bad.
Yeah, I know. I have like my own searchable database, I feel like, on my email inbox.
Oh, absolutely.
But, it's always there. You can just type in the name and it's there. Probably a couple weeks ago or maybe a month ago, I'm trying to remember timing wise, you had your leadership development conference.
Yes.
Is that the right way to say it?
I call it Leadership Development Institute. I think I learned it through Studer.
Okay.
The Studer group call it LDI.
LDI, yes. Is that annual?
We actually do it twice a year.
Okay, twice a year. Mm-hmm. So you brought many leaders together, hundreds of leaders together.
We brought all of our management group across what I call Vandalia Health North, or the Vandalia Northern Region Mon Health System leaders together.
Yeah, which was amazing.
Including invited our medical directors. Doctors who are mostly clinical but take on a role. And we had, as you know, we had a few doctors who took the day out of being with clinical practice to be there to hear and learn and share as well.
Yeah, it was a very impressive agenda. Shout out to Kristen Rogers because I know she was very involved in putting that
Katie
together.
Davison are just fabulous.
Yes, very good. And I was honored because I got to be there for the morning session to moderate a panel. Yep. And so I thought it'd be really fun to ask you the questions that we crafted for the leadership panel. So I'm just going to kind of run
So I need to do
this.
A shout out of who some of those CEOs were, if I can.
It was. And you secured an amazing panel.
Well, I wanted diversity. So we asked Jeff Sokol of Mountaintop Beverage, but he had a last minute conflict. We had Taylor Hardy.
Yes.
With 84 Lumber, Nema Colon, and
Hardy World.
Yep. We had Morgan O'Brien, who both of us are just, and I'll say it, I'm in love with the
President of Fan Club.
Morgan with Hope Gas, who I know for many years. We had Dave Thomas with Clear Mountain Bank. And we had the new president of Fairmont State, which I serve on the board with, Dr. Davis, Mike Davis. And you were an outstanding moderator. I mean, it was a great group. And then what kicked us off in the morning was WVU baseball coach Randy Mazie kicked us off too.
Who was incredible.
So we had really different perspectives of leadership, and they were all very gracious to give of their time to share their insights with 180 people.
Yeah. And I always feel like it's so helpful. Anytime I've ever delivered a session where part of the agenda is leaders coming in and talking about real world experiences, I always feel like when you start looking through the feedback forms or talking to people, that's oftentimes what they really seem to value or put at the top of the list.
And I try to say a lot that I want my managers to be the CEO of their area. Yeah. And I think I went through the list. I look at it, title or not, but chief executive, my job is to execute. Mm-hmm. I go to the next level, my vice presidents, they're to set the tone and set the agenda along with me. We're storytellers, we can go through that. But then directors direct, managers manage. Supervisors supervise, coordinators coordinate. I mean, the words mean something, but at the end of the day, you own the units in which you're responsible for. Yeah. You have to drive it. You're responsible for the profit and loss. You're responsible for the regulatory aspect. Mm-hmm. You're managing people. You're managing tasks. You're managing projects. You're managing care delivery. Mm-hmm. They own it. Yes. And we need to empower them to do the right thing, and then also be there to back them up, to coach them and reinforce. Yeah. So it was great to hear these people, and you'll ask me questions, what their guiding principles are, and hopefully they heard glimmers of why we keep saying, at the end of the day, you are the leader, then you have to lead.
Mm-hmm. Yeah, and you had a CEO panel, so they could get a picture, a window of what that looks like for each of those individuals.
And hopefully the guiding thing they heard, and I heard a lot of positive feedback, is they weren't the typical just people that they work with each and every day in healthcare. Mm-hmm. You had a gas utility, you had a public university, you had a real estate company, you had a bank, and then you had a sports leader. Yes. I mean, all of them are different in certain respects, but the guiding principles shouldn't be that different.
Yeah, absolutely. Okay, now wait, before I go into these questions, you said something about the storytelling. So can we go back to that really quick?
I believe a leader, there's so many roles. Deb Rice Johnson, who is a leader at Highmark, I remember her saying, and David Holmberg, who's the president of Highmark, both of them said, and it's never left me, is that the CEO is the chief storyteller. Mm. We have to set the tone and understand and describe the why, the what, the where, the when, and the how. So leaders have to be able to understand and translate the message shortly. I talk a lot. Unfortunately, that's good or bad. But I have to tell the story of the Mon story, the Vandalia story. Yeah. Politicians who are, God bless them for running for office, they know a little bit of a lot, but not as much depth as they can on their own because they have so much to study. Yeah. They have to look at trusted advisors to give them the context. Yeah. And I've always said, in my case, I'm going to tell you the truth. I'm not, some of it may be slanted to what I think is in the best interest of my system or my organization. But I've worked in Pennsylvania. Mm-hmm. I've worked in Virginia. I've worked in Maryland. I've worked in West Virginia. I've worked in Texas. Mm-hmm. I've seen lots of different things in my short career. I'm going to tell you what I've seen from variable places, not just here. Yes. And then I can ask Morgan, and I can ask Taylor, and Dr. Davis, who was originally at James Madison University for 18 years, and now is the president of Fairmont State, Dave Thomas. Everyone's been around. That's not a bad thing to learn from variable people and to hear their stories to hopefully create the new reality.
Yeah, it's huge. I just enjoyed listening to them as well. But then I was thinking as we were having this panel, I wish David was on the panel because I want to hear David's responses to these questions. But private audience, here we go.
All right.
All right. So first one is, how do you inspire others to action?
I believe it's a calling to be in healthcare, and I take it personally, probably a little bit more personally than maybe I should in some respects, but every decision is always, what's the outcome going to be for the patient? Yeah. So when I inspire, I try to be authentic. I try to be reachable. I really work hard. Maybe the bigger we get, the harder it'll be to be accessible and to try to connect the dots. So when I say inspire, I look at the positives, putting the doctors at the table with us to drive strategy. I learned that from Cindy Hunderfeen, who was the CEO of Allegheny Health Network when I was with her for a while. John Paul, the CEO before that. They really wanted to engage clinicians. That's the huge. Cleveland Clinic way. So to me, inspiring is, if you're the patient in the bed, what do you want? If you're the patient sitting in that waiting room at the emergency room, what do you want? When people come into the hospital, what kind of greeting do they want? So to me, it's inspiring about, what is it you expect if you were that person, and to try to drive it.
Yeah. Oh, I love that. And telling the story, right?
Always.
Very good. Okay. This is a big one because I feel like a lot of organizations are really struggling with either getting people in the door or once they get them in the door, how to retain and engage the people that we have. And I know you all work very hard on this. So I'd love to hear your perspective on that.
The engagement comes with empowerment. You have to be able to trust your people to do the right thing. And I'll give you an example. I was walking through the lobby of Mount Health Medical Center the other day, and I saw two people at our front desk. If you come in the lobby, they're standing there in the front, and their goal there is to be able to help guide people where they need to go. And I was talking to one of the gentlemen, and the other person who was there, I could overhear a little bit of a conversation where they were talking. This person came from afar. The visitor had a suitcase. And I'm listening, I'm like, okay, what's going on here? And I'm listening more, and I heard the person at the front say, oh, let me get you a cup of coffee. You've had a long day. Let me get you a cup of coffee. And I went, I didn't know we gave free coffee away. This is fabulous. Why haven't I got my free coffee? So I started following, because people know when I go into the cafe there, I'll usually leave $20 and say to the person there, just buy for whoever comes through next. So I'm listening, and I see this person leave the front desk, goes to a different area, and got her wallet. And I choke up because candidly, this person's my sister who works there. And she went to buy a cup of coffee for this person.
Out of her own money. Because you don't get free coffee.
And then I said, wait a minute, and then I said, you don't have to do it. I will do it. The woman came from a different city far away. Her loved one was having surgery at the hospital. She came in, she had a long morning. It was a rough weather morning. And here she is, and we're offering it. Do you know what that meant for that person to get the cup of coffee? It was a safe, soothing way to start her experience. And then for me to see this person go on their own initiative to do this. And it is my sister, so that made it even more special. That we were taught by our mother to take care of people. So when you see that happen authentically.
Yes, without someone telling you to do that.
And it was me walking by, and those kinds of things happen 24/7, 365 that we don't know about. Dave Ramsey says, our CEO of Vandalia Health, what's exciting when we're on these integration phone calls and recapping what's going on, there's so much things, good conversations, good sharing. We don't know what's happening, but it's happening.
Yeah.
That's, to me, the secret sauce.
Yeah. So I just remembered something that I meant to email you and forgot. So I'm just going to tell you live on this show. I was doing a piece of work for a client related to culture, and I was doing culture conversations with employees. And so I run through questions about their culture, what's working, what's not working, what do you like, how would you describe the culture, et cetera. But then I also had a question of, if you think about other organizations that you might potentially admire for their culture. So it could be a company that you buy their product, or it's an organization that you receive services of. Who else, when you think about companies or organizations do you admire from a cultural perspective? And I had someone say Mon Health.
Oh, that's great.
Yeah. And
that's
they said, everyone there is so nice, from the cafe to wherever I go. Everyone there is so nice. And I can't believe I forgot to tell you. But when you brought that up, I thought, oh my gosh, I have to share that with you.
I'm biased. And I know I'm biased, but I really do think we have the best people. And when I came to Mon many years ago, people said, why did you leave the larger job that you had at Pittsburgh to come here? I said, one, I love West Virginia. I mean, I'm a big, I love my Mountaineers.
Yeah.
Met my wife here. She's still putting up with me after almost 30 years together, 25 plus years of marriage. I have so much I owe this university for, but to see these people each and every day do what they do selflessly really is a difference. So last night was the holiday party for our surgery center. It's a joint venture surgery center between private surgeons in the community, and we own a piece of it. Yeah. And they brought their staff. And they invite us to come down. And I've never been able to before. And last night I had a little bit of time. So I came in, Dr. Matt D'Armelio, who's a very awesome gentleman. I joke with him, it's his fault I'm here. He and Dr. Susan Capella were two doctors who stood out with me during my interviewing process.
Oh, they're both great. Yeah.
I just think the world of them. But last night was his retirement party, but also holiday. And I asked if I could just talk to the staff, and I just wanted to thank them for what they do, because there isn't a day that goes by that people in the community who've had a procedure there don't just glow about the experience, the feel, the cleanliness. People know the difference. Yeah. And I'm thrilled that our people have empowered our staff to go the extra mile to make sure that they are putting the patient and the visitor in front. But we also have to empower and make sure we take care of our colleagues.
Yes. And I think, though, the more people that are empowered to act that way, to know that, hey, the right thing to do to take care of this person is to go buy her a cup of coffee, regardless of whether we have a handbook or a policy that tells us we can do that or not. I think that spreads. That's contagious. I think when people see that, coworkers see that, oh, I could do that too. Yep. And then it becomes, well, what are some of the things that I can do to make someone's day better or brighter?
It starts with making your day bright.
Yes.
This was a rough week for me. I had a lot going on. I had a couple crabby days, and I warned my colleagues around me. I said, it's not a good day. Just stay away. And I warned them because I knew I was crabby. Yeah. I wasn't, I was dealing nothing bad.
Yeah.
It was just the day got away from me.
Funky weather this week. There's just a lot.
It is. But, I had a woman I work with in Texas many years ago. Her name is Susan Always. She was my assistant when I was at Baptist in Texas. And she was great. She knew where all the bodies were buried in Texas. I kid you. And she would come in and, it was one of those days. And she said, "Sir, I'm turning off your computer. I'm turning off the lights. I'm taking your phone off, and you have 30 minutes to do nothing."
Nice.
She knew I was getting at my level. A good friend of mine, a former assistant of mine up in Pittsburgh, her name was Denise. I called her Radar O'Reilly. You'll learn I nickname everybody. She knew how to manage me and navigate me, and also knew when I was getting to my limit, which is so special. So I'm actually interviewing for that. I call it a manager of strategic implementation, because now I'm getting to the point to the emails. I copy people, and it's following up on the details.
Yes.
And I'm getting to the point. And this week was one of those weeks it hit me. There's so many things starting to come onto my list that I felt like the Swiss cheese. It was starting to fall through. Yeah. And then I take it personally. And then it's, the good Jewish guilt in me is what have I done as a poor leader? Why am I not staying on top of it? These things are falling through, and I have to realize I can't do it all myself.
Only one person.
And I got great people around me, and all the time I look around, and we had a board meeting this morning, and I looked at my team sharing, and I just sat back, and it's always been this way. I am so proud of the culture that we have, and it's hard to maintain it and to make sure that people always feel empowered to do the right thing, to speak up. I tell people all the time, into our front line when we're bringing them in, when you talk about engagement, we're still interviewing you as well as you're still interviewing us.
For sure.
And that if you feel that we're doing something that just doesn't make sense, raise it. Now, we have rules and regulations for a reason around it, but that doesn't mean, I joke, don't let us mon you too quickly. You came from a place where you either learned or did something great. While you're following the rules and regulations as they are, raise them up, raise the flag. Let us learn from where you came from, so maybe we can do it better. The integration with CAMC to create Vandalia, the integration now with Davis, some other things that have been happening over the last year. It comes down to they ask the why and the how.
Well, and I think you're giving people a voice too, and allowing them to speak up. So not only empowering them to speak, but then also letting them know that they have that opportunity. That's huge, because I do feel like a lot of times people don't feel like their organization wants to hear their thoughts.
It's funny. I had a colleague in our organization say today, we were talking about doing town halls, and the person said to me, well, I always, when I round, I ask them, and no one asks me the question, but when you come, they'll ask. And I went, well, why should it be me? So what's the difference that they feel they can ask me the question, and I'm 2, 3, 4 levels up in the organization, not in stature, but I'm removed from it.
For sure.
Why is it they feel they can ask me? It should be as easy for them to ask you and you to answer as is to me. So I don't go to every town hall. I don't go to every department meeting. I can't, nor should I. I have leaders in that place. However, I'm setting the tone of what the expectation is. It's telling the story, defining the story. And then from there, it's I trust that my people will execute on it. And I use the adage, we're Missouri, the trust me state, trust but verify. Show me. Show me. And the results, I put the results up every time. Here's our strategic plan. Here are the tactics to the strategic plan. Here's how we're doing against those tactics. And then those goals are your goals. There shouldn't be any cognitive dissonance that what is on paper isn't what's expected of you.
Yeah.
If we deal with falls every day, the federal government requires us to look at our fall rate, fall with injury. To me, any fall is something that we look at. Why did the patient fall?
Sure.
Why is it a goal? Because one, a fall can lead to fracture. It's bad. It's a bad outcome. But it's also, we're measured against falls. For example, I could talk about sepsis. I could talk about other kind of things. So why do you think it's a goal on your unit to look at your fall rate? Because we don't want inadvertent people falling and hurting themselves inadvertently for care. That's always the number one reason. Two, it's what causes from a fall.
Yeah.
Did we not monitor them timely enough? Were they on medications that we didn't really take into account what that impact could be to them? A lot of people want to still go and toilet on their own. Well, if you just are on a medication that makes you a little loopy, should you be getting out of bed?
And you're not at your house or whatever your
happens a lot at night.
Yes.
When people are coming in and checking your blood pressures around different times and taking blood and all that, and then you're getting, I call it pricked and prodded through the process, and then I'm up, I'll go to the bathroom, and then you fall.
Yeah.
So are they close to the nursing unit? Do you have the monitors or the mats down? So if they do get up, it alerts. There's so many things to avoid the injury.
Yeah.
Well, that's a goal of a unit, which then goes up to the next unit, then goes up to the chief nurse, that goes up to the hospital, that goes up to the organization as what we call measures of quality.
Yeah. But I appreciate you sharing that, because I will say I hear a lot of feedback, even from the C-suite and then down, about the CEO being too much in the weeds, too controlling, too micromanaging. And to me, I can understand why someone in that position is feeling the weight of the responsibility that, hey, I am ultimately responsible for the success of this organization. However, I think you've shared and detailed, you have some measures in place. Number one, you can't do everything and you can't be in every single detail, but you're also, when I hear you talk about things like, I trust the people that are on my team, I empower them, but I also set expectations for them to
And I ask a lot.
Yeah.
I do ask a lot of questions why. And I think that's important, because after your fourth or fifth why, I've shared this before, you kind of get to the root of it.
Yes.
And I am into the details probably a lot more. I've done 360s. Of myself. And I remember when I was at Allegheny, I wanted to do a 360 to get a sense. And the feedback from my team then, and I guarantee if you were to go to my team now, they will say the same, that I'm a micromanager.
Really?
I've had that back in the past. And I really took that to heart, and I really was bothered by it because I really don't want to be. But I'm a very into the detail kind of person. Now, my wife will say, oh, he does that at work, but he isn't worth a darn at home. But I really am into the detail, because I really think the small things lead to the big things.
Yes.
And it's not that I want to thwart it or take away the responsibility of a person, but I really believe, and it's just the way I'm wired. My mother, who now lives here in town, says, David, you move so fast. Not everyone is thinking the way you do. And I said, I don't expect everyone to think like me. You don't want 20,000 Davids. Trust me, you barely want more than one David. But I really do believe the details matter. Now, that being said, it's how you react to it, I think, is important. And I really hope over the years, as I continue to grow professionally, that I'm letting up a little bit, trusting a little bit more, but I'm never going to stop being inquisitive.
Well, I mean, and I think trying to understand or get to the root cause of something, I mean, there's nothing wrong with wanting to know, well, why are so many people falling, or why did one person fall? It doesn't even matter how many. I mean, one is too many, I'm sure. So understanding that root cause, but at the same time, to your point, the way you react to it, I think matters too, that you're not like, how could you let that happen?
No. Oh, I have no doubt I've come across that way. I was saying to someone today, you'll never get a note or a text from me if I'm upset or disappointed. I'll pick up the phone and call or say, can we talk, whatever that is. I ask a question. I'm very quick on my email and my text. We were in a meeting at one of our facilities, and I had to cancel the meeting. And I said, can you send me your notes? And I looked at the scorecard, and there was a quality issue on there. It was 1. Now, the denominator of how many patients had that issue was very small, but it was one.
Yeah.
So I said, how did this one thing happen?
Yeah.
Well, I didn't realize by sending it, and I kept it to a small group, not to everybody in a small group, but I didn't realize after, boy, that really made an impact on people, and it wasn't what I meant.
Yeah.
But I came back, I called that person after. I said, no, I really wanted to know,
Just
how did
curious.
the one,
Yes.
Tell me what your process is. I'm trying to understand, because that one meant something.
Yeah.
And I said, I'm not chastising you. I didn't mean it that way. So even inadvertently, sensitivity you got to take into account. And I'm not perfect at it by any means, but I hope I'm thoughtful enough when I send the note out. People, at least at Mon now 5 years later, those who've known me for 5 years, I think have gotten used to me. That was not the case early on. I had one leader say to me, I thought I was empowered to make these decisions. And I said, you are empowered to make the decisions, but with it comes out the other side of it is when you make the decision and the outcome isn't what it should be, you're responsible for that too. That's what comes with the big chair.
Yes.
It's not just going to the parties, getting the bonus if you're on an incentive plan and all that. But it's also when things fail, when there are gaps, when you have a bad outcome, when your ER isn't moving fast enough to get patients in and we're getting complaints and grievances and the numbers aren't moving, that's as much yours as when you got that world-renowned recognition for that wonderful quality outcome.
Yeah, that's huge. And that's hard because we enjoy the fun aspects, not so much the challenges. Well, this is funny because the next question was what's most understood about you as a leader. So
I'm intense.
Yeah.
And I don't mean to be, formidable. I don't want to intimidate anyone. That's not who I am. I'm not. But from a leader, I hope my friends and my colleagues would say what you see is what you get.
Yeah.
That if we had the bad snowstorm this week, I was at work on time. Now, I live downtown. Some people live still a little further out.
Yeah.
Our chief nursing executive, chief administrative officer, Dr. Crystal Atkinson, lives 7 miles away from the hospital. It took her 3.5 hours to get to work.
Yeah.
I live in a condo downtown, and I was at work in 15 minutes. But I was there. Now, when I got worried, I came into the parking lot, and there were a lot of empty spots, which meant I didn't have a lot of staff in. I woke up not expecting snow. Neither did anyone else because the roads weren't treated. And I'm thinking, wow. So I got in, our associate chief nurse was there, and she said, we have held nurses over, we've held phlebotomists over, but we can only hold them over so long before it's a concern from a labor practice perspective and their ability to stay awake. And everyone got in on time. But I was like, I have scrubs in my office and I was ready to go in if I have to go clean. And people know I will do that. Now, my mother, who's a volunteer at the hospital, is folding all these documents today. So she called me last night and said, can you bring these? She brought them home and she's folding them. They're not anyway private, documents. It's just a notification kind of that you have to do every year. And she goes, hey, you can help me fold. I said, I'm not going to help you fold. You're doing a good enough job, but I'll bring him in my car and I'll bring him to work for you tomorrow. But I should be able to, at any time, be able to swing and be able to be productive at the patient level or the colleague level as easily as I'm in a meeting in my office.
But I love that humility, too, that you're not walking in the door thinking, well, not my problem. I have my to-do list today.
If I do that, then that means someone else can do that. That means the next level can do it, and then the thing doesn't get done.
Yeah, absolutely.
That's just how I think about it.
I love that. All right. How do you balance, and this I think is so challenging, how do you balance leading people with the operational aspects of the business? Because either one could probably take 100% of your time.
I'm a doer executor. So I lean towards the operations side, probably more than I need to or should, but that's just how I'm wired. And I think people have gotten used to me in that regard. I'm not saying it's right or wrong, but I think there is balance about how do you manage process, people, and then technology, or technology, then people, then process, depending on the situation. I think it's a constant struggle to hopefully be somewhat self-aware to it. And the good thing is I have a fantastic partner, my wife, who I'll tell a story about during the day, and she'll say, did you really say that way? And I went, yeah. And she goes, David. And then my daughter, who's now graduated college, lives at home, works locally, and to watch her working into the evening And then I reflect on myself and I'm like, did I set a bad example that she hasn't let go? Now she's doing it because she's home. You know, she didn't grow up here in Morgantown. She doesn't have as many friends as we do. So it's, you know, she loves her job. She's as happier than I've ever seen. And I listen to it. And then there's my other daughter who's at college and we talk often through the day, probably calls a lot more than most. I remember calling my mother for that. And I hear what they're saying. So it's, did I role model the right things? So then that's the life lesson as a parent is watching how it turns. Am I that good at home? And is it translating to work? And is it translating into my personal life?
Yeah. Ooh, something to think about for all of us, I think, and reflect on. Very good. Okay. What areas of your leadership style, these are kind of, these kind of go hand in hand, but what areas of your leadership style are you currently trying to improve or develop?
I'm probably the worst critic of myself because I don't ever think I'm good enough. Yeah. And that's not, I'm not saying that to be hokey. And I'm not saying that to build myself up. I shared this story before, but when I was at Baptist, one of the icebreakers was, what's your tagline? And I remember standing, we did strength finders and I have it still taped to my wall. I brought it with me everywhere I've gone. And I'll never forget, I just stood there and said, what's my tagline? And I stood there just like this and it was never satisfied.
Never satisfied.
and people looked and said, and I'm not, because I think the minute you let it down, the minute something bad could happen inadvertently or overtly. So my thing is not to be too intense that I forget the why, not be too much where I intimidate people to not be empowered to do, but also not give up enough that I'm not constantly just driving us forward. In a way to help benefit not the business, but the community we serve.
How do you balance that with, because I think people have different levels of their own standards that they hold themselves to. So never satisfied is not everyone's tagline, right? And so
I hope not.
So how do you, I see people sometimes get very frustrated when other people don't hold themselves to that type of standard. And I'm just curious if you've experienced that in your life and how you've managed that.
Yeah, I had John Paul, who was our boss at Allegheny Health Network, he was famous for saying, if you don't strive for perfection, you never get there. And he was an architect with Jeffrey Romoff and a host of great talented people at UPMC up in Pittsburgh to build a multi-billion-dollar huge conglomerate healthcare provider. And I don't think bigger is always better, so don't take it that way. But that adage has always been in my mind. If you don't strive for perfection, you never get there. And it's a very high bar.
It is.
But when you're dealing in our business, and I guess if Morgan was here, he's dealing with utility. Look at the terrible, not that it was Hope Gas, I want to be specific on that, but look what happened in Charleston with gas lines and water got into the gas lines and people. I mean, there's life and death situations and fulfillment in utilities. Dr. Davis is educating the future through his university. Taylor with Nemacolin, with 84 Lumber, with real estate development. Dave Thomas with his bank. Everybody has something that's important to their imperative, to their customer, to their business to move forward. Well, it's no different in healthcare. The minute I let go one little bit, a life can be impacted by it. If I make the wrong investment in something and then I have a bad outcome, did I make the wrong decision? And that's really where I'm wired. And I'm not saying that's the right thing. That's just where my mind goes. So at the end of the day, I try to recap what went well, what didn't.
I like that.
And then I try to look and say, okay, what do I need to revisit? And I'm constantly, and I have a little tremor in my hand, so it's very hard to write now. So I text it a lot to myself. I'm constantly emailing and texting to myself. To remind myself of something. And then candidly, when I have a doctor telling me I've emailed so-and-so about an issue and they haven't responded, I do take that personally because that doctor is asking for something that he believes or she believes is going to impact a life. I want to make sure it's answered timely. It could be a no, but it shouldn't be waiting for a response. Because if that's the culture I'm setting up, then again, I take that personally and that's not right. It isn't me. I got multiple layers, but it's a high bar. So I want to ensure to myself that I'm not being overly taxing on people, because if I'm that way to me and I'm bringing it to the next level, there's a consequence and a ripple. Now, that being said, we just did our employee engagement pulse check. And we had some of the best results from our peers. It isn't what David thinks, it's what does the data say. We had nearly 70% of our population respond and participate in the survey.
Well, that's a really high response rate. Well done.
And including our doctors.
Wow.
Getting a doctor to answer an email from me, let alone here they are responding. And we had 40 or 60 nurse practitioners, physician assistants, or doctors take the time to respond to a survey, which doesn't sound like a lot, but we employ about 500. Yes. And we had a little bit over 10% or about 10% of the doctors respond.
That's great.
And what we heard from them very clearly is we're excited about the trajectory the organization is undertaking. Good. We feel empowered. We had 1,800 comments.
Whoa.
Katie Davidson, God bless her every day. I call her COVID Katie. But Katie, she started here when COVID hit in West Virginia, so I say you brought it here.
Yeah.
But Katie read every comment. She gave me access, and I read every comment. I don't know who that was who said it, but I know the comments.
You went through.
And I could see more positive today than I remember 2 years ago that we had. Wonderful. Now, it's not about COVID, but the organization is evolving.
Yes.
We were CAMC was chosen for the 5th year in a row by Forbes to be an employer of choice. Mon Health just got a recognition. Can't say by who yet, but will be coming out.
Amazing.
I take that seriously. What do the people who work with us say about us as a place to work?
Yeah.
And I think that's important.
Yeah. And that's that striving for perfection and not, I mean, again, with you saying, like, I'm an intense person, I think you're very careful about
I hope so.
managing that intensity so that it doesn't come across as like, everybody has to be this way.
But culture drives a lot of it. And good, bad, or indifferent, I've come from different places. I grew up in New Jersey. I went here for undergrad. I moved to Northern Virginia, hustle bustle. Yeah. Then I moved to Texas, a little bit of the South.
Yeah.
Then I moved to Pittsburgh, a little bit different.
Yeah.
Then I'm here. All of them are different. And my style isn't good everywhere.
Sure. Yeah.
And I hope I'm not overly accelerating to the point where we can't keep up with it.
Yeah.
Because it could be really easy to just keep going and then get tired. And then I look back, where's everyone who was with me? Well, I ran a 2-minute mile where I have to run a 9-minute mile if I'm going to do the mini marathon or the full marathon.
And that's what I think is hard for people is because we all do have different paces, just like we have different standards. And I think that can be potentially frustrating if there's not an awareness of, I might be running a 2-minute mile and I've got to make sure that everybody's with me here because it doesn't matter how fast I'm running if I'm running by myself.
I try after every meeting with my colleagues, is there anything I can do for you? And I mean it. A lot of them have gotten used to me now that I really mean it. At first, it was like, well, you gave me 22 things. And now all of a sudden you're asking me what can you do? Don't give me 2. Don't give me 22.
Can you take this list away?
But they also see, I hopefully am up here and I'm looking, I go to every board meeting. And people think I'm insane. Like when we negotiate the Davis deal, I wanted to be a board member at those hospitals, just like the Mon hospitals. And the reason, not me, David, if I get hit by a truck tomorrow, the person who replaces me, it isn't about wielding a vote.
Yeah.
I learn at every meeting I go to, and I'm constantly writing, and I saw this at Preston, I saw this at Stonewall. Yeah. I go, Dave Ramsey and Dr. Glenn Crotty are so gracious to let me go to some of the CAMC board meetings too, even though I have no authority over them. Yeah. I learn every day. They're doing this here. Why are we not doing this here? They're sharing about this here. They have an award for staff. Why are we not sharing that at our board meetings the way they are to the South? Yeah. So, I mean, it's the little things to the big things, and you learn by attending.
Yes.
And it's a lot of time.
It is.
Way more than I want to, because every time I'm in a meeting means I'm not getting the other work done. But I do think it's important to show the respect to those people who are giving time in that venue and then learn from them and then bring that forward.
That's huge. I'm sitting here listening to you thinking, literally, how do you manage all of this in a day? I mean, have you just gotten really good at learning how to say no or
No. I serve on boards. I know.
You respond to email. I'm like, I'm embarrassingly slow at responding to emails. I'm like, David Goldberg is killing me with the emails.
But candidly, I have to thank my wife and I have to thank my daughters because it is a sacrifice of being at home with them to do this. And they've gotten used to me, I think. My wife said to me this week, she goes, I feel like I haven't seen you this week because it's been, and I said, tonight's date night. Aww. Tomorrow we're going to a craft fair with her tomorrow. And then we have a holiday party, Saturday night for a work colleague. They're very giving and they're very supportive, but they also know it's like, David, enough already.
Yeah.
Do you really have to go to that?
So they can
Do you
keep
really
you
have
in
to
check.
do that? And it's as much to remember, I moved my family multiple times. They sacrificed.
Yeah.
Now, I think they're better for it and we're stronger for it, but they've sacrificed as much as I have.
Yeah.
So when I see and I hear that I'm pushing the envelope a little bit too much for them, it's a wake-up call. If I'm doing it to them, I'm doing it to me.
Yeah. Ooh, I love that. I love that. Okay, yeah, you do have date night, and I'm not going to get in
No,
the way
no,
of that.
no,
So
fine.
last question.
Sure.
Best or worst, or both, leadership advice you've ever been given?
Best advice that I've ever given. I was a consultant early in my career, and I was young.
Mm-hmm.
I knew what I was doing, but I was still learning every day. And I remember I had one boss just said, just give him an answer. It'll be all right. We can fix it after. Give him an answer. And then I had another boss who said, no, if you don't know, it is okay for you to say you don't know, because if you give the wrong advice and then they take it and it fails, and you did it just because you wanted to instill confidence rather than you really are giving the advice, and I'll never forget that.
That is good advice.
So the worst advice I think I was given is, you're only human. Think about that for a minute. You're only human. So is that okay to be humans? We're not perfect people.
Yeah.
And no, we're not human. We're people.
Yeah.
So understand the people you're with, and I want to make sure I emulate the culture I want.
Yeah.
I joke all the time when I go to orientation is, I'm here to greet you. I want you to understand the energy, the enthusiasm, but that can be exhausting. So, I'm a work in progress.
Mm-hmm.
That's how I look at it every day. We all are.
Yeah.
And you got to surround yourself with people who are going to tell you the truth, not tell you what you want to hear, but tell you the truth. Yes. And it's taken a long time to get people to be comfortable. Mm-hmm. And even in this conversation, I talk fast. I talk as I process. Mm-hmm, mm-hmm. So I need to remind people I'm processing this. Yeah. Let's talk it through.
Yeah.
So I'm a work in progress a lot with my colleagues, and I need strong personalities around me in their own way.
Yes.
To be able to be comfortable in their own skin, to push back and to share and to be able to stop and have the debate. The other aspect, I think is I'm not clinical. I can't represent the doctor, the phlebotomist, the physical therapist. They need to drive it. But I really believe in the why. Why are we doing that? Why did you do that? Not why it's
how
bad.
Dare you? Yeah.
Why?
Yeah.
Why?
Help me understand.
So
that's so huge, though. And I think about, you've had such an incredible leadership journey, and you've been very honest and gracious with your time today. And I appreciate you sharing these lessons, because I think something that I'm hearing a lot about, especially lately, is a lack of team members actually willing to push back or engage and saying, hey, I don't agree with this, or, hey, that email that you sent, I don't know what your intent was with that tone, but it really felt very overly critical to me and really upset me. People are just, it's like the cancel culture, right? So they're just, I'm just going to cancel you. I'm going to quit. I don't want to work for you. Instead of just saying,
the quiet quitting. That's the big thing that's happening.
Can we talk about that email that you sent? Or, hey, I feel like, you're running at a pace that's way faster than I was prepared to go. And I don't feel like people are having those conversations in the workplace anymore. It's just either an explosion of, of emotion, or it's the quiet quitting.
And I think some people, it's easy to just fade away
and
go somewhere else, and sometimes deal with the big issues. And I'd rather deal with the big issue. If I don't agree, and we have a meeting that we do once a week now with a group of leaders to kind of prioritize. And I'm a lot, because I in the past, before the merger, I got a certain level of detail from this particular area. And now I'm not getting the same level. Mm-hmm. And I keep asking why. And I want to see the detail. I want it to be transparent. I want to understand. And I'm not worried about the color of it's done or not done. Is it on the list, and are we making progress? And then what I do now is I go with all my other senior leaders across before that meeting. Are we aligned? What are we missing? Don't let me be the only talker. You need to be able to talk too. And that's all the way across. So you have to be comfortable. And I hope every day that I'm setting up a culture where people are comfortable. I give a lot of credit to go from running my own organization when I was the sole CEO, but now I'm part of a system while I run my market, but I'm also a senior leader in Vandalia. Dave Ramsey has been wonderful to give me a platform to still be able to execute on the strategies I think make sense. I still bounce things off him. The gentleman has been here for 20 plus years running CAMC. He has great experience. Why would I not tap into that?
Absolutely.
I still call colleagues from around the country and said, I'm dealing with this. What have you done in this? It's okay. That doesn't make you a bad leader. I think it makes you a bad leader when you don't ask for help or counsel or coaching.
I think so too.
And I think we get caught up in it. And I try to say that to my next level leaders. Why have you not asked other people? Don't do their job for them. If you're their crutch and you're doing it for them and you're sheltering them from executing their own, then I don't need them. But I do that. Last night I called Dave and I said, I'm going to have this conversation with this person. I want to run this by you, not because I need your validity, to validate it. I just want you to know what I'm going to do. So 1, are we aligned? 2, in case it comes back the other way and you hear about it, I don't want you surprised. And 3, I want to make sure that as we're driving the mutual culture of what we want Vandalia to be, are we aligned? He was great. I mean, he goes, no, this is perfect. This is exactly as it should be. And then he bounced an idea off of me that has nothing. That's what I think in the workplace. Now, we're literally 2 hours and 21 minutes away from each other. He's in Charleston. I'm in Morgantown. Jeff Sandine, our chief financial officer, is stationed out of Charleston. We have a regional vice president. I'm texting with him during the day. We're on plenty of Zooms or team meetings throughout the day. It is if we are down the hall from each other. And I think that is how we're able to get done what we're doing.
I think so too. I mean, I think as I listen to you talk, I think about the fact that you're strong. You're a strong leader, you have a strong personality, but you are surrounding yourself with strong people and you are choosing to operate as a team. As opposed to, well, I'm in charge and what I say goes.
And I don't think that's a sustainable model.
No.
Look at any organization around. When you have one person at the top, what happens when that person goes away? Most of the time, if you don't have the systems in place, it'll fail. There's been public companies where people get in trouble. When they go away, what happens to the company? It starts to fold. So you're only as good as the people you put around you. Now, I'm not invincible. One day, hopefully I'm going to win that big lottery and I'm going to retire and I'm going to play a lot more golf and travel. I mean, but at the end of the day, do I have a successor for me at Mon? There's people I know that if I need help or I need to step away or I do step away or I'm asked to step away, which you live at the pleasure of your board each and every day.
Absolutely.
Who's my backup? Now, some organizations have a backup. We have multiple people that today could do a lot of the technical parts of my job. There's a lot of people who could do the external part of my job. There's other people who can manage through it. We're all replaceable. Hopefully, I'm growing the next level leader, and I am blessed to have some of the best people around me.
You do. That's amazing. Well, thank you for not saying no to me and coming on this podcast because it's been amazing.
I hope it brings value to some people listening to it. I am by far not a perfect leader. I make more mistakes, I think, than I make good outcomes. To me, it's all about learning from the mistake to make yourself better and make your organization better and to be able to drive people to be humble enough to say yes and like this and to be able to share, but also to move forward.
Yeah. And that's why we're doing this is there are no perfect leaders and there is not one single way to do leadership. So trying to give examples of strong leaders, the lessons they've learned and what their style is for other people to listen and think, never thought about trying that.
That was the panel that we did that you moderated. Yes. Same thing.
Yeah, exactly. Well, thank you.
Sure.
Lightning round?
Sure.
Okay. Now, I'll have new questions for you, but this is as a reminder from the last time. It was 60 seconds to answer as many open-ended questions about you as you can. Okay, your timer starts now. This will be a good one for you. Best place that you've ever traveled to?
Oh, Scotland.
First job?
I was a busboy.
Nice. What was your favorite subject in school?
Political science, civics.
What's the best gift you've ever received?
My wife gave me a blue Movado watch when I graduated college.
Nice. What's your favorite quote or verse?
I'm never satisfied.
I love it. What superhero do you most relate to?
Doctor Strange.
Dr. Strange. Okay. If you could have any fictional character as your friend, who would you choose and why?
Tony Stark, and I love how he tinkers.
Yeah, nice. Beach or mountains?
Beach.
Cake or pie?
Pie.
Summer or winter?
Oh, definitely summer. Need to play golf.
And best gift that you have ever given?
Oh, best gift that I've ever given. Ooh.
Oh, my little Christmas timer just went off here.
I don't know what the best gift I've given. I would think to my mother a few years back, she needed a car. And we bid on it at a particular charity event, and then someone else outbid us, and then came back, and then we were able to get her car.
Aw, I like that. That's a good story.
Yeah.
I like that your family's all involved in Mon Health too. I feel
well,
like
us Goldbergs are a lot. We're a different breed. But you know what? It just worked out that way. My mother's a volunteer. My sister moved here a couple years ago. She was looking for an opportunity. We needed it. It fit well.
Yeah.
My wife volunteers well as works, in the community. So
that's amazing.
I think it speaks a lot that we all believe in the mission.
Yeah. No, I genuinely think that's amazing.
Thanks.
Very good. Thank you again so much for being here.
Thank you for the opportunity.
Absolutely.
Good to be with you.
That's all the time we have today on Leadership Rediscovered. Until next time, shine bright, everyone.